Hi, my name is Eileen, and this is going to be my post-assessment video for postpartum. And this is my patient, Michaela. Yes, she's obviously not old enough to have a child, but she's going to have to do it for now. So, walking into the room. Hi, Michaela. My name is Eileen. I'm going to be your nurse today, and I'm going to be doing your assessment. Is that okay? Okay, and at this point, I wash my hands inside the room, and then go ahead and clean off my stethoscope as well, which I don't have alcohol salts, but if I did, I would. So, all right. So I'm gonna start with the basics of. I'm gonna get a set of vitals. So blood pressure. I'm gonna get some pulses, pulse, probably O2 saturation, temperature, respirations, and then I'm gonna ask about pain as well. I'm not gonna ask her because she's gonna answer weird things, but let's pretend like I did ask her. And then that way I can assess what kind of level her pain on a scale of 1 to 10 is, and also where it's located at, where it's centralized at. Okay, so I'm gonna go ahead and Michaela, and I'm gonna listen to I'm gonna do all my stethoscope work. So I'm gonna go ahead and listen to your body right now, okay? So I'm gonna listen to. I can't hear myself talk with those in, so I would listen to her lungs. Just breathe normally for me, okay? And then I'm going to go ahead and listen to the 5 different points of her for her heart. Are you counting for me? That's very helpful of you. Thank you. And ending with the apical down here. And while I'm on the front, I'm going to go ahead and also listen to the vowel sounds. So just breathe normal. Thank you. All 4 quadrants. Your bowels are very active, Michaela. And then at this point, I'm going to go ahead and have you sit up for me, okay? And I'm going to listen to her lungs on her back. Now, like you mentioned, most people who are having babies are generally healthy. So I'm going to start at the base of the lungs, and if I know anything abnormal, then I'll move up farther. But I should only have to listen to the base of the lungs. Just take a deep breath for me. And a deep breath. Okay, perfect. No, go ahead and sit up for me. And at this point, I'm also going to check for CVA tenderness on the kidneys. And tell me if this hurts, okay? I accidentally hit her. Sorry about that. Okay, you can go ahead and lay back, Miss Michaela. Thank you. So I would also, at this point, I generally, when I'm in a room with somebody, like to make a little chit chat. Otherwise, it gets really quiet. So I would ask her if she didn't have her baby with her. I would go ahead and inquire about what's your baby's name.
I don't have a baby.
Okay, well, if you had a baby, what would you name it? And that would also be worrisome if the mother said that, just so you know. The mother said, I don't have a baby. That's obviously, at the end of our assessment, we could put that towards emotional. But if you had a baby, you just had a baby, what's your baby's name?
Isabella.
Isabella. Oh, it's a beautiful name. And then I would, start going through our bubble heat. So go ahead, lay still. For breast, there's a couple different ways you can do it. You can obviously just look straight at the breast, but I personally would find it easier to check it if she had the baby or when she has the baby come back, and for breastfeeding, so that way you can kind of kill 2 birds, 1 stone. You're not only looking at the breast to make sure that there's no nipple cracking or bleeding or any inflammation or anything like that, but you're also able to see how the baby's latching, which can resolve a lot of the problems. So I would look at her breasts, and then I would look at her uterus, which I'm not obviously going to, but I would I'm going to be looking for the fundus, which it should at this point, since she just gave birth, be right about the umbilical level, and I would push on it, and it should be firm, not boggy, and it should be about midline. Obviously, if it's elevated up and to the right, it's probably because she has a full bladder. And when I would ask, when was the last time you've gone to the bathroom? Do you need to urinate? Good questions to ask in case she's retaining your urine. Oh, good. Well, it feels perfect then. And then if it is boggy, we would immediately want to go ahead and massage, because that could be a sign of hemorrhage. And just a quick note, when pushing on the fundus, you want to make sure you hold at the bottom of the uterus so you don't accidentally shoot the uterus out. So, I don't want to do that. So we got BU, we've already done. B for bowels, and B for bladder. I asked her, especially if you start pushing, you can tell if it's a full bladder or not. But you could also at this point be like, when was the last time you urinated? And I know most
1
hospitals,
minute ago.
1 minute ago, have hats on the toilets so you can keep track of your output. So I would ask questions about the amount and when. And then L for lochia. So this is something that I'm obviously just going to talk about because I'm not going to do it on my 7-year-old. But we would want to look at the size and the color of the lochia coming out, and we want to especially notate smell because any foul smelling could indicate infection. And then we want to sorry, hang on a second. On that one, color, amount, consistency, and odor. And obviously, this would be a good point for teaching and to say that, hey, this should be starting to go down and should not be bright red later on. You okay? Okay. So now we're going to move on to E, and that would be for this one would be episiotomy. If she had an episiotomy, not everybody has one, and then we should have notes on whether it was a first, second, third, or fourth degree episiotomy. Hopefully she had one, it'd be a first, fingers crossed. But we are going to check it for, it will be swollen, but that's another question we can ask about pain if she has one, and if it's painful, add an ice pack to it. But we want to check the sutures, and we want to just check and make sure there's not any active bleeding, that it is, has the normal amount of swelling. And then for H is going to be the Homan signs. I'm going to see your legs, my dear. So this is what I know. They said not to do this normally, but like obviously we do. We're checking for tenderness. So I'm going to squeeze the calf. It does tickle. That's good because if we had pain, that's where we'd be worried. But we're looking for edema, any kind of targeted pain, if it's warm to the touch, anything that could indicate a clot in the legs, especially since they're on bed rest and whatnot. So those don't hurt, just tickles, no pain though? Okay, so good. All right, I'll stop doing that. And then our last E for bubble heave would be emotions. And that's when, like I said, generally when I'm in a room with any patient, I like to just have a conversation and chit chat, otherwise it gets awkward. So it's a good way to gauge on whether or not where the mother's mind is. You know, if she makes a comment like, what baby? That's obviously a problem. But if she's like, this is my baby Isabella, I'm in love, she's got her father's eyes, you know, that's what we want to hear. We want to hear some kind of bonding and the taking in process at this point. We want to assess and make sure that there's not any postpartum depression happening or the baby blues. So we just want to make sure that the mom is able to fully connect with the baby and see where her mind is mentally. Otherwise, we'll get her help. So yes, that's a postpartum assessment on a 7-year-old. So thank you very much.
This is